All right, Dr. Kaytlyn Wells, thank you so much for being with me today. How is your day going?
It's going well. Yeah, I'm super excited for this. So thanks for having me on.
Yeah, absolutely. I know that the listeners are going to get so much value off of out of everything that you're going to share with us today. So, before we dive into the meat of everything, can you share a little bit about your background, both athletic and your professional background?
Yeah, so we'll start professional because I think that's a little less hectic. So um ended up going to a small community school to get like my associates. But really I went there to like play softball. And then from there I transferred to like a bigger university, got my bachelor's in exercise movement science. And then from there I went 3 more years because why not?
Why not? Yeah.
Yeah. And then got my doctorate of physical therapy. And then I worked in the hospital for a little bit throughout clinicals and everything, kind of realized that the traditional based model wasn't really what I was into. So actually like right after school, I think it was 3 months where I finally was just like, yeah, no, I'm doing it full send. So
Nice. And when you say like the traditional model, what do you mean by that? Do you feel like it wasn't customized quite enough, or like what made you want to go out on your own instead of just working like for a specific hospital?
yeah, good question. So insert tangent one here. But I just feel like the traditional model is excellent for a lot of people. However, I am super passionate about barbell athletes, so powerlifters and Olympic weightlifters. And I feel like a lot of times traditional healthcare kind of one overlooks the lifter. And, it's like, well, if it hurts, don't do it. And that's like one of my biggest things that you'll probably hear me say a few times. So I don't like that idea. And then two, I saw that in therapy, a lot of people tend to get underdosed, meaning, if they're used to pulling 700 pounds off the floor, doing these little glute bridges with
Right.
no weight, and on a therapy table isn't going to help them get over their back pain
Right.
with 100-pound deadlift. So I kind of saw the flaws in that. And even like the geriatric, so like the older population, they also get underdosed. So I had a clinical where I thankfully had they're called CIs, like clinical instructors. I had a guy who just kind of like let me do whatever. So I had this like 70, 80-year-old freaking kettlebell deadlifting and like doing little goblet squats down to a chair, and it was awesome. But it really kind of opened my eyes to, what therapy could actually be. So
Yeah, absolutely. Yeah, I think with the geriatric population, there's so much hesitancy to actually have them move weight when they're very capable of doing so. And I
yeah,
get a lot of people asking me, like, are you still planning on powerlifting when you're 80? I'm like, gosh, I hope so.
yeah,
I hope
yeah,
I'm lucky enough to be able to do that. But in my opinion, movement is medicine. And when someone is having knee pain or back pain or whatever, it's very common to tell them, well, don't squat, don't deadlift, don't do these things. It's like, well, squatting is a fundamental movement that you do in your everyday life, whether you have a bar on your back or not. So you wouldn't tell someone, don't sit down in a chair because your back's hurting, right? So like it doesn't make sense to tell somebody not to squat. I'm not saying don't listen
yeah,
to your doctor, but just a very generalized statement, like you would find a way to work around those limitations and essentially eliminate those limitations because it's not realistic not to be able to sit down.
yeah.
Right.
I have a similar example that I like to use too, and it's if somebody who might be overweight, goes to their doctor and is like, doc, I live in a 2-story house. My bedroom's on the second floor. I have knee pain going up the stairs. Like, what's your advice? They're going to send them to PT, or they're going to like say, oh, well, maybe diet and exercise is, what you should do.
Right.
So they're giving them the solution, and it's like a pretty decent solution. But then if you have a lifter come in, it's like, doc, like my knee hurts whenever I have like 500 pounds on the barbell, I'm squatting, what's your advice? And he's like, well, just don't do it. It's like, why is it okay for you to tell someone who's actually like living a healthy lifestyle and like being active and doing what they can, to like just not do it, but you can tell this other person, oh yeah, like let's find a way to like work around that. Like, and two, not this is its own little thing, but a lot of times I find like powerlifters get into powerlifting because like mentally it helps them. Maybe
Absolutely.
they've went through like a dark time, maybe they've had some rough stuff come up, and so powerlifting is that outlet. So why would you want to take somebody's outlet away from them if like that's what's helping them function like as a full and whole human, you know?
Absolutely. Last night I was lucky enough to be part of a women in powerlifting forum, and they were going across the board talking about why they got into powerlifting. And that was a very common theme across the board. Like, there were so many things going on in my life that I couldn't control. This is one thing that I could. I low self-esteem, confident, all of those things. And the gym has turned into therapy, right?
Yeah.
And you make friends and you build a family at the gym, and it's very much a part of your life. And it doesn't, mentally, it's not good to take that away. Like, I don't know what I would do if I wasn't able to lift every day.
Oh, I would be an asshole. That's what would happen.
Yeah, it would not be a pleasant person to be around.
No.
It's like a bodybuilder on their last week of prep with no carbs, and they're just not pleasant to be around. That would be exactly how I would be. So, so tell me a little bit about the relationship that you have as far as like your business with physical therapy, and then also being a strength coach. Like, what is that? Do you do PT for your strength athletes? Do you transition one into the other? Like, what does that look like?
Yeah, so honestly, it's kind of a blend, like a hybrid. So there's some people that come to me that already have coaches, and that's fine. I don't care. I'm not there to talk you out of hanging out with your coach. However, if it's something that they're like having pain with, then it's, okay, how can your coach and I kind of tag team where, if we know 400 pounds on your back is painful on your back, your knees, or whatever, even shoulders, there's a lot of people that actually come to me with shoulder pain, and we can kind of tie it back to squats. So we just kind of do like the full assessment and see what's going on. And from there, the athlete, the coach, and myself kind of come together and form this plan. Sometimes the coach is like, do whatever you need to do. I just want them to lift, Sometimes the coach is like super involved, like, okay, what can I program? Like how do I help you? Same thing with me. It's like, okay, do you have to squat right now? Yes or no? Okay, are you going into a meet? Yes or no? And if the answer is no, cool. We can do like pin squats, or we can do box squats, or we can do some other variation that kind of allows that tissue to calm down, and then just build up from there. And so that's one approach. I do the strength coaching as well. And so what that looks like, I typically get people who have had injuries, whether they're currently dealing with pain or, they've had pain, it's been tremendous amount of pain, and they're nervous to get back to that, which rightfully so. So they like the aspect that, I do bring the PT side of things to the table, because they know that if they get in pain, they can kind of feel confident that we're going to be able to get out of it, no problem.
Absolutely.
And so really, I just kind of blend the two worlds, the strength coaching side, the PT side, and just formulate it into like one program. So
that's awesome. And, I think the blended approach is really the way to go. Over the years, working with so many, different types of clients with different backgrounds and injuries and things like that. Not necessarily having a physical therapy background, but you do learn a lot through the strength training world, right? But I do have a resource that I utilize all the time as a physical therapist here in Nashville, where I live. And I refer all of my clients to him. I can text him if I'm like, hey, I have a client with this issue. I can't quite figure it out. What would you suggest? And I think that needs to be more commonplace for strength coaches and physical therapists to have that connection, have that relationship, because at the end of the day, our goal is the same, right? To get the client moving pain-free. And so I love the fact that you kind of combine those within your own business to give a more well-rounded approach to the whole training process. So that's awesome.
Yeah, no, it's awesome. And kind of piggybacking off what you said, the PT strength coach relationship is definitely underutilized.
Absolutely.
And I think a lot of the time is traditionally, generally speaking, PTs don't understand strength training, and strength trainers, coaches, whatever, don't necessarily always understand the PT side. And so hopefully we get to a point where there are more PTs kind of working to like bridge the gap between traditional PT and strength coaching, because whenever the two can come together, it's like, I don't want this to sound cheesy, but it can be like a super beautiful thing. Like it is so cool and can really just set the athlete up for a lot of success. And, I mean, it's just awesome.
Absolutely. I have one athlete, and her and I were trying to figure out what was going on with her hips for months, and trying all different types of things. And it started off with just like a nagging pain when she was squatting, and then it turned into a severe pain when she was squatting, and then it just snowballed into couldn't deadlift, couldn't really walk correctly. And we actually went to the session together and did the full assessment. The PT gave us, a couple things of what it could be, and then recommended she go see a doctor. Turns out she has hip dysplasia, which is a much bigger issue than what either of us thought it would be. And as a competitive power lifter, not being able to squat or deadlift is very challenging. However, her mindset has been very positive still, and we actually are 5 weeks out from a meet. So she's just gonna be doing bench only. So still have her in the competitive world, but like just having to, if I didn't take her to that physical therapist, which then led to the doctor's appointment, like I would have no idea how to fix that problem. Right. So like that partnership in the end ultimately helped her with something that was a lot more serious than what we originally thought it would be.
Yeah. And something, it's kind of off a little bit, but you mentioned that she's just doing a bench only meet, but still being in that competitive world.
Mhm.
I feel like a lot of people's hang up, and this is just like across the board, everybody as a whole, like people think of things as black and white. It's like, well, if I can't squat, bench, and dead, I'm not going to go compete. But you have that option to either do like a push pull, you can do bench only, like there's so many different things that you can still do to get like that powerlifting's, itch scratched,
Right.
if you will.
Absolutely.
So yeah. And I see the same thing with rehab too. Like it's not always a black and white, templated thing. It just varies person to person. So
Absolutely. And as a result, honestly, her bench has skyrocketed because we've been putting so much focus on that. So yeah, she's having huge gains there. So not mad about it at all.
yeah. No,
so transitioning kind of a little bit, what, like amongst all the clients that you see, what are some like very common issues that powerlifters face? Like what are some common injuries that you have to deal with?
oh man. If I had to pick two, I would say probably shoulder and back.
Gotcha.
I'll see like knees, I'll see elbows, I'll see hips, but a lot of times I would say I typically see the shoulders and the back for sure.
Gotcha.
Men and women both.
Yeah, that was going to be my next question, if it's consistent amongst male or female. Now with the back issue, because I get that one a lot as well, particularly from people who are kind of just starting out in the powerlifting, the strength training world. Do you find that it's more so low back, or do you find that's lat issues?
Yeah. So I would say the most common reports, I don't want to call them complaints because that sounds like, they're being sissies, because they're not. But reports that I get is low back, and it's usually like a QL, like
Right.
people will be like, oh my gosh, my QL. And sometimes it is QL related, but a lot of times it's, just either kind of an overloaded area or an underloaded. Yeah, they just like had this crazy ramp in volume. I don't see any that's like, I don't want to say any, but a lot of times I see more of that overuse, underuse versus like a true like ligament tear or something like that. It's usually just kind of a gradual process into pain versus like, oh yeah, that was a legit injury,
Right.
Yeah.
So do you think a lot of that comes from like an improper pre-lift warm up?
It could for sure. And I think a lot of times it comes from ego lifting too. It's like, oh, I see that guy down there doing like 4 plates, so I'm going to throw on 5 just to, show him who's the bigger guy.
I could probably do like a 2-hour episode on ego lifting.
Yes. There you go. Yeah, no, that can be podcast number 2 for us.
There you go.
But yeah, and I kind of said that in kind of a like male context, but females are so guilty of that too.
Oh,
It's not just a dude related thing. So
yeah. Female powerlifters are just as competitive as the males. So
I think they're a little more vicious, but yeah.
Probably. It is funny, like when I'm in the gym and I'm training and, squatting or deadlifting, whatever, next to whatever guy is next to me. Like he'll look over and he'll kind of see what I'm putting on the bar, and then he'll look at his bar and he'll like, okay, I got to put something else on there. I'm like, oh, I don't think you should do that.
Yeah.
But can't let a woman outlift you.
Yeah. That was my favorite thing to do whenever I was powerlifting more, because I do Olympic weightlifting now. But
gotcha.
when I would see a dude in the gym, I'd be like, all right, I'm going to throw a little bit more on just so I can like top him real quick.
Yep. Also on that forum that I was on last night, they were saying that as far like just with powerlifting overall, as far as like from Dots and Wilks are concerned, women are actually at the top. So based on the coefficient and pound for pound, like women are outlifting men now, which I think is insane, like super exciting. And I'd love to hear it. But yeah, ego lifting can definitely get you into some trouble.
And obviously, like we're both kind of, well, I'll speak for myself. I won't speak for you, but like I'm guilty of it too. And I know better, but just because you know better doesn't mean you always do better.
Exactly. Coaches aren't perfect. So we try and practice everything that we preach, but sometimes we make those mistakes as well. So with low back being like a very common issue that you see, what is your take on weight belts?
So I think that weight belts are completely used for the wrong thing, if I'm being honest. So was it you that we were talking about how people just like strap up a weight belt and just kind of like walk around, or like maybe go do triceps or something stupid like so weight belts definitely have their time and place. For me, I have a rule just for myself, like if somebody wants to do it, whatever. For myself, I never use a belt unless I'm getting like 80-85% and then above.
Right.
So a lot of times my dad was actually one of these people too. And, not to, kind of bash him, but he would be like, well, make sure you wear your weight belt if you're going to do that. And I'm like, why? Like, it's not going to protect my back if it's going to, explode like people think,
Right.
So in that sense, I don't think weight belts necessarily protect the spine. The caveat to that, though, is whenever you put that weight belt on, if you cinch it down, if you're breathing and bracing correctly, and you're like pushing into the belt, you do get like a little bit more of a support just because your abs and your core have something to brace against.
Right.
So if you want to get super technical, maybe there's like a slight chance that it can, quote unquote, like protect your spine. But more often than not, it's just going to help you brace a little bit more efficiently, use those abs, the core, and just like execute the lift that you might not have been able to do if you weren't having like 110% of that brace, if that makes sense.
Right. Absolutely. No, I completely agree with you. I talk about this all the time with weight belts. It's not going to do all the work for you. It's going to support the work that your core should already be trained to do. Right. So I never recommend, especially like if people are newer to lifting, to start training with a weight belt, because one, you're going to get reliant on it. And two, if you're not properly bracing your core, the weight belt is just there. Like it's not really doing anything. Like you have to be able to support your lower back through, utilizing the abs. But like you said, the weight belt is really just there to provide something to actually brace against and create a little bit more tension. But I'm right there with you as far as like, once I get to that kind of 82, 85 range, then I'll start to put it on. But if I'm on a lower volume day and let's say I'm only doing, 2 reps, like, I'm not gonna put it on.
Yeah. Oh yeah, sure.
Yeah. And I just think that people become very reliant on the weight belt, and just, equipment in general, really, whether it's wrist wraps or knee sleeves or whatever. I think that people become a little too reliant on it and don't actually train your body to do what it should be doing.
Yep. No, 100%. I agree.
Yeah. What about like wrist wraps and knee sleeves? What are your take on those?
So are you talking about like preventing injuries or just use of in general?
Just the use of in general.
Yeah. So knee sleeves, powerlifting sleeves are a little different because they are so thick, like the ply is just ridiculous. I have some, they're just like compression sleeves that I like to wear, especially during the winter. I've had a couple knee injuries, which kind of goes back into like the personal side of, my journey. But so I really like to use those just because they feel good. Now, if I had like an actual knee issue, I would not want to like use that Band-Aid.
Right.
I would want to make sure that things are moving the way they're supposed to and make sure that, if I was going to have pain, I wasn't masking it or putting a Band-Aid on it. Right. That's the difference, is like, are you using it because it feels good to have like, that compression on there? Or are you using it to like cover something up? And a lot of times people use it to cover it up. With wrist wraps, same thing. Since I'm doing Olympic lifting and I have a competition, I've never worn like the cloth ones. And so I'm using that, like the cloth ones, at lower volume or lower intensity right now, just to get used to like lifting in them. But otherwise it would be the same thing as the weight belt. Like I don't use those unless I'm getting up to like an 80, 80 plus kind of thing.
Gotcha.
And again, I asked my coach, I was like, these are like, they're cloth, like what are they going to do? But essentially, like whenever you tighten them down, it's the same thing as like a weight belt. You're just allowing like those muscles to kind of kick out into that, like that soft brace kind of thing. So
now, do you think that they are more beneficial for people who already have injuries in those areas, like a weight belt, for example? If you do have a back injury or low back injury, do you think that is going to provide the extra support, or do you think it's irrelevant to the issue?
No, I think that kind of goes back to putting a Band-Aid on something. So if they have, obviously it's a case to case.
Of course, yeah. There's really no blanket statement for any of this, but
right. Yeah. But I think if you want to use a weight belt because you've had an injury, my first question is always why? Why do you want to do that? Like, what do you think is going to happen if you don't use that? Or what's your reasoning for wanting to use it? And if it's like, oh, it's to protect my back, and it's like, okay, well, we need to like work up, we need to build the strength and not use it as a Band-Aid and like fix the underlying issue. And then if you want to, just because, you think it's going to help you improve your performance and like more of a sound argument versus just like, oh, it's going to protect my back, then I'm all for it. There is a caveat to that. And sometimes, if we're going through the rehab process, they're 100% fine. They've demonstrated time and time again that their back is solid, but mentally they're still a little lagging, like they're still nervous. If it gives them that extra little bit of confidence to like walk up under the barbell, then I'm like, okay, because I know that we've put in the work up to that point, however long the rehab's been. If I know without a doubt in my mind that back is healed up, it feels good and we're fine, and I just want it for like mental peace of mind. Okay.
Yeah, absolutely.
It's another tangent for another day, but I'm not huge on like cupping and massage guns and stuff. But if Michael Phelps, because he was really big into the cupping, if Michael Phelps wants me to freaking put cups on his back because he thinks it's going to help his performance, then guess what I'm going to do? I'm going to put cups on his freaking back,
There you go. So, yeah. There you go. So you touched on something that I want to dive into a little bit more, but the there's so much mental recovery that comes with the physical recovery,
Mhm.
right? So like once someone gets injured, there's always this fear that it's going to happen again. So as a coach, like we have to not only coach through the physical, but also coach through the mental. So how do you typically approach that?
Whew. Um, Honestly, I would say if someone's had like a pretty rough injury and it's taken a mental toll on them, the mental side is a lot harder to recover than the physical for sure. So it's almost like a graded exposure kind of thing for me. It's putting them in situations where they feel confident, but it's almost just a little scary. It's like progressive overload for any muscle or any movement. You don't just jump into a 400-pound squat without really ever training up to that, right? So it's the same thing with the mental side of things. And I feel like it kind of coincides hand in hand, as we're, because I use like the progressive overload with my rehabs. So as we're building up the physical, we're also building up the mental, and they're like, oh, like cool, like that actually didn't hurt. And I ask questions that kind of almost leading types of questions where it's like, hey, how did that feel? And they're like, they have to like take a step back and they're like, oh yeah, that actually didn't hurt at all, like it felt good. And I always feel like when somebody's like forgetting how their back feels, or I'll stick with the back thing because that's what we've been talking about, but when they kind of forget to like monitor that, that's usually a pretty good sign that the mental side of things is also like healing.
Mm-hmm.
And sometimes it takes time and it takes reps under a certain weight. So if somebody got hurt at 315, they're going to be kind of shy of 315.
Right.
But if you can do 310, for like 6 sets or whatever, then it's like, okay, next time we're just going to try it, and we might take a few extra safety precautions. Like if it's on a squat, we might just throw the arms up a little bit higher, or something, so they have that safety net, if you will, mentally. And
Absolutely.
then once they hit it, then it's like, oh, like that didn't hurt. All right, let's try another one. Let's just see what happens, and kind of build them up from there. Just progressive overload.
Absolutely. And also just like mentally seeing the weight as well, because most people, when they visualize 315, it's 345s on each side, right?
Yeah.
But if you have 310, it's going to be, everything but the extra 45, right? So like just throw the 2.5s on each side, you'll never know.
Yeah.
Like visually, it just looks different, right?
You might be able to attest to this, but I'll have clients sometimes that if you tell them what the weight is, they freak out. Even if they haven't had an injury, they'll just kind of freak out. And it's like, they'll be going over and getting you like some water. And I know that they can hit it. So I'll just like kind of slide it on. And then after the fact, I'll be like, oh, hey, did you know that was that weight? And they're
Yeah.
like, no, like, I was like, see, you can do it. It's just a confidence thing. So,
Absolutely.
yeah.
It's the same thing like when I take athletes to meets and I'm,
Yeah.
given the rest of the numbers and all of that. The third attempt, I never tell them what they're going to hit
Yeah.
ever. It's 99% of the time it's something they've never touched before.
Yeah.
And for any of my lifters that are listening, don't pay attention to this part.
Just plug your ears.
Yeah, exactly. But when you're walking up to the platform, like people are like the athletes are so in their zone, they don't really know what's going on around them. They don't hear the crowd or anything. Like you're just paying attention to what you need to do, and that's it. And then the weight is called out in kilos. So then like it's hard to do the math really quick, right? If you don't know your kilos like the back of your hand. And so I usually don't tell them what they're lifting. And then most of the time they're going to get it, right? Because I know exactly what they're able to pick up, right? And it's the mental barrier of knowing what that number is. As soon as you remove it, then it's easy.
Yeah.
It's easy.
Oh, I intentionally like look like a jerk in the gym because I'll have, so with Olympic lifting, you have all those little small plates where it's like 5 kilos, 2.5, 2, whatever. So sometimes I'll just keep throwing those on and not even pay attention. I never add up what's on there because I know in kilos, like kind of where I'm at.
Right.
And I'm like, that actually happened today. I was like, I'm feeling good. I know that this is getting up there close to like my PR. So I just like added weight and like just walked away, didn't even add it up. And then I ended up hitting a PR today.
That's
But
awesome.
I know that wouldn't have happened if I would have like counted it and been like, oh, like this is over,
Yeah.
Yeah.
Just get in your head.
Oh yeah.
Was it clean and jerk or a snatch?
Both actually.
You hit PRs on both?
Yeah.
Dang, girl.
Yeah.
When are you competing?
What's that?
When are you competing?
May 21st.
Awesome. Well,
Yeah.
can't wait to look on your social media for you getting that little gold medal.
Yeah, I'm excited for sure.
That's awesome. That's awesome. Um, so would you say that with Olympic lifting, as far as like the type of injuries that you see, does it vary much from Olympic to power?
Yeah, so I typically see Olympic lifters have more of the well, they'll have shoulder, but it'll be a different type of shoulder injury. That's kind of like what I was saying before we started recording. There's like different variations, different shades of injuries, right? Like a back injury isn't the same as like a second back injury or something.
Right.
And then I see a lot of knee injuries, and I think in large it's just because of all the squatting that you have to do with Olympic lifting. So
Absolutely. So what would you recommend for like a competitive Olympic lifter as far as like preventative measures to take for some of those common issues like knee and shoulder?
yeah, so for shoulders, check your T-spine. Like literally cannot stress that enough. Most of the time when I have people have pain because of a snatch, in their shoulder, first thing I have them do is just work on that T-spine extension. So that mid back extension. And then for knees, it sounds counterintuitive, kind of like the shoulders, but I like to look at the hips and see what's going on there, because if one hip's moving different than the other, chances are that hip or that knee could also be the one that's affected on that same side. And so I like to look at that and just see any differences and things like that. And, sometimes with Olympic lifters, you have the patellar tendonitis. So that tendon is just like super inflamed. And the way I work around that is just by loading it. So we get some isolated and direct loading to the patellar tendon, the quads, and, we're usually pretty good to go. I will say, in addition to the knees, always check your ankles too, because a lot of times people use lifters and they think that they can compensate for poor ankle mobility, but it still puts your knee in like a compromised position and causes pain. So
Absolutely. I mean, it kind of goes back to the conversation about the weight belt. Like if you're not moving properly to begin with, there's not going to be any benefit to it.
Yeah, for sure. And mobility work to just statically stretch is one thing. I'm not a fan of just static stretching. However, if you're going to do mobility work for your range of motion, load that crap up, because otherwise, whenever you get into a lift, if you're at that end range of motion and you haven't properly loaded it before, that's when pain can occur. So by doing the mobility work and stuff, with a quick warm up, or just going through like the empty barbell and like actually getting directed loading there, it can actually save you like a ton of time down the road with injuries and stuff.
Absolutely. Yeah, I see a lot of people do static stretching before they lift. Can you kind of go into a little bit of details to why you don't recommend that?
Yeah. So for me, I just don't like it because it's not functional, in my opinion. Like you're with mobility work, you're still lengthening the tissues, but you're loading them at the same time. Whereas if you just stretch and stretch, you're almost in some degree like weakening that area. I see a lot of people that will feel tightness in their back or their shoulders or whatever. So guess what they do? They just sit there and just crank on it, and they just stretch and stretch and stretch. And 6 months down the road, nothing's changed. Their pain's still the same, maybe even worse. And a lot of times the body is just like telling you that it's tight because it wants some input. So whenever you stretch, you're actually making it worse. So I kind of already have like that bias towards stretching because of that anyway. But I mean, mobility is one of those things where it's like you can just get more bang for your buck kind of thing, versus just static stretching, because you're not really going to move in a position like with squat, bench, dead, any Olympic lifts, like you're not stretching during that, but you're going to work in end ranges of motion where you need to make sure that you're nice and strong there instead of like super stretched out.
Absolutely. And about how long should lifters be like doing some type of pre-lift mobility work prior to actually starting their workout?
Yeah, so it kind of depends. My lifters who have come to me for injury and stuff, once we figure out like what's going on, based on an assessment or whatever, then it could literally take like 5 minutes, and then they go into like their warm-up sets and stuff. For let's see, I have a lifter, she's a power lifter. She hurt her hamstring, so not doing powerlifting things, she was doing yoga. So what we were doing was like hamstring sets, and she had some pinching in her hip, so we started doing like banded mobility. I noticed that her foot spun on squats, and so we started working more ankles and stuff like that. And so I just really like break down, the components of things that she'll need in the squat, make those her warm up, and then she goes right into squat. And I have a warm up guide, and I don't think anything on that is more than 12 or 15 minutes. So the warm up shouldn't take you very long. And if it is, like, look at why it's taking so long. Like, are you foam rolling for 30 minutes and then like getting into static and then getting into dynamic and, all that stuff? I like to use kind of like I don't really like the word preventative, but like a prehab kind of exercise list. And it might include like lateral step downs for like that glute med, so that whenever you're down at the bottom of the squat, and you're starting to come up, you're in that adductor whip position where your knees are kind of coming in. And then once you get to like halfway, then you can really use those glutes to kind of bring your knees back out and stand up. So I'll use like lateral step downs. But the way I like to do warm-ups is almost a WOD style, where it's like, I want to focus on good form, but it might be like a 12-minute AMRAP, just to see how many rounds you can get through, get some blood pumping, and then also like be super efficient with it. So.
Gotcha. And you don't feel like doing an AMRAP style is going to fatigue the muscles too much for the lift?
No, because, even though it's an AMRAP, it's still like kind of a go at your pace. So you don't have to go in and try to hit like 30 rounds in this little AMRAP, but just making sure that, I might have the lateral step downs, I might have some bear crawls, I might have open books, things like that. So while it's an AMRAP, it's more so just to make sure somebody's doing it efficiently instead of spending like an hour on warm-ups. So I haven't found that it wears my lifters out. Everyone that's used that style, like that I've kind of put on that, they all like it. So
yeah, I was just clarifying because I've never thought to do it that way. Like the dynamic warm-ups, absolutely, but like to actually do it to time. And when you said AMRAP, I'm like, my mind's like, oh, CrossFit. And I'm like, that seems like it'd be very exhausting, but that makes a lot of sense.
Yeah, no, I put it down like as a disclaimer, like, do not go crazy. Just, the point isn't to jeopardize form or like wear yourself out. It's more so just to warm up, but doing it in an efficient manner where you're not like doing one movement and then foam rolling for 5 minutes or talking for 5 minutes and then doing another, so it's like you get in and out of the warm up.
Gotcha. Yeah, absolutely. Because us lifters, don't like to spend a lot of time doing the mobility and the pre-lift things. We just want to get to the barbell. So as far,
I said I'm kind of guilty of that
too. Oh yeah, me too. Absolutely. Again, we're not perfect either. Absolutely. But coming off of like my very first like pretty serious injury happened last year, like severely strained my pectineus muscle in my left hip. I definitely take the warm up a little bit more seriously than I used to. So it's like having to work through like my very first injury that actually took me out of squatting for a while. Like I definitely I can sympathize with my clients a little bit more, because like I do actually know that pain of not being able to do something that you want to do. And, thinking back to, like, we were talking about the mental recovery piece of it as well. Just I wasn't scared to get back under a barbell. I was getting back under a barbell when I shouldn't have been.
Yeah.
And probably honestly made the situation a little bit worse, and probably prolonged my recovery, because I wasn't doing it the smart way. Because when this happened, I was just starting a prep for a meet, which didn't end up happening. But it definitely made me put more of a priority on like properly warming up my body. And then also focusing on the recovery, not just in the gym, but outside of the gym as well, which I think is a component that a lot of people don't take into consideration, like how much your lifestyle outside of the gym is going to impact what your body is capable of doing inside of the gym.
Yeah. And Ash, I'm pretty sure we're supposed to be best friends, because that's stuff that I preach all the time too.
Yeah.
And I honestly feel like I could talk about that stuff for like 3 hours. I always say, like, your lifts are made more so about like what you do outside of the gym than what you're doing inside. If you're just fueling your body with junk food, fast food, and not sleeping, you're drinking alcohol, your stress is at a 10 all the time, like, what are the chances that you're actually going to have a good lift? Like, yeah. And that's when injuries happen too, is because, your body's in this like not very recovered, not very repaired state. And then you go in and, try to crush a lift anyway. And yeah, so that's a big topic of like what I talk about with my clients first day. I'm like, this is what, like, these are important things. And just know that if these aren't intact, you might feel more pain. Like it's very possible. So
Absolutely. And, part of the coaching role, like we're not just coaching people in the gym, we're coaching people outside of the gym as well. And if all of those things are not falling in line, it's going to be so much harder for an athlete, or even, just someone recreationally training, right, just to be healthy, to hit whatever goals they set for themselves. And one thing that I always preach is, if you think of professional athletes where this is literally their job, like they are hyper aware of what they're putting in their body. Like they prioritize their recovery process. They don't drink. They don't, go out and do all these things, right? That way they are able to perform at their best. Not saying that you're not able to live your life, right? Because you can be social, you can go out to eat once in a while and all those things, of course. But there does need to be a huge focus put on that recovery piece and everything else that you're doing outside of the gym in order to hit your goals inside of the gym.
Yeah. And just knowing that there's a trade-off, if somebody wants to go to a wedding and have some drinks, like by all means, go do it. Just know that the next day, whenever you go in to train, even if you're not like hungover, like you're still probably going to feel like crap under the barbell, just because like your body just doesn't respond that well to the alcohol. And, same thing with fast food. Just know, like, if anybody tracks their, like with a Whoop or Fitbit or whatever, if you track like your heart rate, go eat like pizza or fast food or whatever and see what happens to your heart rate.
Yeah.
And if it can happen, like if a spike in your resting heart rate can happen, think about everything else that's happening too,
Exactly.
Yeah.
Exactly. Yep. It's you definitely have to look at it from a holistic approach. Absolutely. Yes. And I think it's funny because there's like a common misconception out there that powerlifters are strength. I think powerlifters more so than Olympic lifters, but they just eat junk food to get big and then pick up a barbell once or twice and then walk out of the gym. And some of them do. We've all seen some of them do. But the ones who are truly successful in the sport don't train that way. And don't treat their body that way, still putting in like good quality carbs and good quality nutrient dense foods in order to give yourself the most bang for your buck inside the weight room. So
yep, for sure.
Absolutely. There's one more question that I wanted to ask you. So as far as like balancing out for people who are still training in the weight room and doing recovery, what does that balance look like? And I know this is going to be a little bit different from case to case, but as far as prioritizing the PT side of things or prioritizing the strength training side of things, what would you say is more important, if there is one that is more important, or what would that balance look like?
I think it probably comes down to the lifter and what's most important. I mean, you already kind of said like the case to case thing, but if someone is, I'm going to get so much flack for this from PTs everywhere, but it's fine. If someone is like 3 weeks out,
Let's cause a fuss. It's fine.
I love it. Yeah. If someone's like 3 weeks out from a meet, I don't care. The athlete doesn't care. The coach doesn't care about making sure that they're good. It's like, what can we do to almost slap a band-aid on this so we can get through the meet? And then after the meet's over, then we can focus on, like actually recovering and healing and all that stuff. So at that point, it's like, what's more important to the athlete? Is it competing, or is it, like getting out of the pain? Like, and finding like the root cause. I still try to find the root cause and say, hey, like this is going on, and then just kind of leave it up to them what they want to do. If someone isn't doing anything for a competition or anything like that, then I personally think that you should have a split between PT and strength. It's something where it's like, okay, we can still do XYZ. Let's just do XYZ in a manner that allows your body to heal. So kind of going back to what I said earlier, if someone has pain at the bottom of a squat in their back, do they need to go all the way down like ass to grass or even hit parallel right now if they don't even have a competition on the horizon?
Right.
No. So what we can do like pin squats where, we bump them up like an inch above where they feel pain, because usually it's pretty consistent. Bump them up an inch, whether it's the pins, whether it's box, whatever. And then, like we still get a lot of the strength work there. And then we strip the bar a little bit. And then we start working in that range as we're doing like XYZ rehab wise, to make sure that we're actually like causing the actual, or fixing the actual issue that's causing all the pain in the first place. And so I think, even just tying it all the way back to the beginning, PT and strength coaching can be like a super beautiful thing whenever it's done correctly. And whenever like, it's almost not a pissing contest between the PT and the strength coach, but when they can work together, then, I mean, it's just going to help the lifter not only like continue to get strong, but also do so in a way that's getting them out of pain. And so, for example, I had my coach actually, he does like general strength training too. So like, just individuals that want to live healthier lives. And so, he came to me and was like, hey, this guy's having some knee pain, especially when he's driving, like what can we do? So between lunges, between squats, he is having this pain, and it's not something that he needed to go all the way down for. He didn't have to hit parallel. He just wanted to make sure that he was getting stronger. And so what we did was, we kind of teased it out. It ended up being like his hips, his hip was moving in a different manner than the other side, which was causing the knee to like kind of get pinched. And so we just worked on some of the hip stuff, and then he would just go straight into squats while he was feeling good. And so that's a way that you can just blend it, or instead of doing forward lunges, he just did like static split squats. We're still accomplishing like a very similar thing, but he wasn't in pain. So that's the biggest thing I feel like is, just meeting the athlete where their goals are, and then working with, a strength coach on my side of things to make sure that, we can get the athlete strong, but we can also get them out of pain.
Yeah, absolutely. And, to get maybe some of the PTs off your back, just to clarify, I think there's like people interchange pain and injury, and they're not the same thing. So, if I did have a client going into a meet and they were having knee pain 3 weeks out, I think that was the example that you used in the beginning. If it's just uncomfortable and it hurts, but it's not an actual injury and it's not going to become something worse over the course of 3 weeks, like strength athletes, we know how to manage our bodies in uncomfortable positions. We literally do it every single day, because let's be real, putting 400 pounds on your back is not comfortable. So the pain tolerance is probably a little bit higher. So, if it's something that the athlete can manage and work through, you know, in the final weeks of that prep, then there's really nothing wrong with that. Like, I'm not going to let somebody do something that I know that they are going to get an injury from. But
Yeah.
pain and discomfort and injury are not always interchangeable.
Yeah, you nailed it. And I wasn't keeping track, nor was I really paying attention to it. But I would imagine, knowing how I view things, I probably refer to it as pain more than injury throughout the entire podcast, because a lot of times, like, people do have pain, but it's not because like their tissue is torn or, you know, like their back's gonna explode or anything like that. You know, it's just kind of, there's pain, and you know,
It's
that's
kind of a part of life, honestly.
yeah. And that's not to minimize it. It's just to say, like you said, you know, tying it back in, like, there's a huge difference between pain and legit injury. You know, if somebody blew out their knee versus, oh, my knee hurts, like, completely different scenario.
Absolutely. You had mentioned a warm-up guide that you utilize. Is that something that like someone can go on your website and get, or is that something that you just utilize for your clients?
Yeah, so it's on my Instagram and it's on my website. I think it's for sure on my Instagram, but if people want it, just email me, shoot me a message, and I'll send it over.
Gotcha. And I'll put your Instagram and your website in the notes of this podcast so people can just go right there and find it.
Yeah.
But Kaytlyn, I really appreciate you coming on and talking with us today. Super informational. And I know that the listeners got a lot out of it. I got a lot out of it.
Good.
I appreciate your time. Thank you so much.
Yeah, thank you. It was a blast. We'll have
and we definitely, I think we have topics for at least 4 more episodes.
For the next year.
Yeah, I made notes as we were talking, so we'll definitely have to coordinate that.
Yeah, hopefully your listeners are cool with that and be like, you know, they're not like throwing metaphorical tomatoes or anything. But
well, my comments on my episodes are open, so we'll find out.
there you go. Sweet.
All right. Thank you, girl.